Hi, this is Angela Lackey, writer of Surviving Ed, the Healthy Place Eating Disorders Recovery blog. And I would like to start with a question. What is so important about being pretty anyway? I started thinking about this question when I read an article by Lisa Bloom, How to Talk to Little Girls. She pointed out that we often go up to little girls and say things like, "Oh, your dress is so cute. Oh, you look so cute. Oh, aren't you adorable? Oh, aren't you gorgeous? Oh, aren't you pretty?" Yes, pretty. And it becomes ingrained early on that it's important to be pretty when you're a woman. It's important to be pretty when you're a little girl. I'm not trying to say that it's wrong to try to look your best, to do your hair, wear a little makeup, wear some lipstick. But trying to be pretty can sometimes lead us down a dangerous road. Now, the causes of eating disorders are many and varied and still not completely understood. Some people argue genetics, some people argue societal influences, others argue a combination of both. I tend to go with the latter, a combination of both. I believe you have to have a propensity toward eating disorders, but I believe society often puts the pressure on us. And part of that pressure is to be pretty. And when you have an eating disorder, such as anorexia, which I am in recovery from, you start to believe being pretty equals being thin. Why, all the models are thin, so that must mean they are the standard. They're pretty. So therefore, I should be that thin so I can be pretty. There was a time I really believed that. There was a time I believed that being a size 0 was pretty. And I didn't see it any other way, no matter how much it was pointed out to me that I was not pretty. I was sickly looking. Finally, I'm reminded of another video that I saw on YouTube by Katie McKay, Makkai, called Pretty. I would urge you to watch it. She talks about the things she went through as a teenager because her mother was horrified that she wasn't picture perfect pretty. She was dragged off to dermatologists. She underwent this and that to become pretty and ended up having a nose job at 16 because her mother said, "You're going to be pretty. You are going to be pretty." Katie pointed out that I haven't seen my face in 10 years. Now, she doesn't have an eating disorder, but I think the relationship, the analogy still fits. She was forced to do many things to become, quote, pretty. And those of us with eating disorders, again, it's not just about being pretty. There's many other things. It's about controlling anxiety. It's about things that go in our mind that tell us not to eat or tell us to purge our foods or tell us to binge and it will make us feel better. But there is a component, I believe, that society puts on us as women, that it's important that we are pretty and that being pretty is the epitome of being a woman. But there's more than that. There's a life beyond being pretty. There's a life of substance, of learning, of growth, of being yourself, of laughter, of having fun, of not worrying about every little tiny thing, if it's perfect or not, if you're not perfect or not, if you're not completely pretty. And I would just like you to think about that and think about the quest for being pretty can sometimes be dangerous, and that we just need to be aware that being pretty is not the only thing that makes us who we are. Thank you for watching, and thank you for reading Surviving Ed at HealthyPlace.com.